Okay, this is my talk about why people need a model like Connecting Care. And it's really about why would mental health professionals, and in particular, private practice and independent mental health professionals, want or need a model like Connecting Care. And I think there's probably four primary reasons, and these are important. They're not even disputable. Number one, employers and even the state of Oregon are already following the lead of Medicare and Medicaid by asking for and even buying quality care. So what's quality care? Well, quality care is defined as reasonable access and positive patient experiences, improving community health, and managing or at least containing costs. Make sense? I hope so. Third, it's about reliable and valid measurement of outcomes. That's about we actually have to measure these things. We can't just say we're doing a good job. We have to be transparent and measure this somehow. And fourth, and this is really the bottom line, those who have meaningful use data for mental health and medical collaborations will have a voice, the ability to provide services into the future, and have a valuable role in healthcare. And what that really means is this: if mental health professionals don't form collaborations with physician groups and gather meaningful data, then the insurance companies are probably going to make us do it, and they're going to have the data, and they're going to decide how we practice, and they're going to run our world for us. So, let's look at the real challenge here in Central Oregon. It's really not about forming an association. It's not about, electronic health records and practice management, and it's not really about forming collaborations with physicians. The real underlying problem, that we're all facing is the adaptation issue. So let's take a look at the adaptation curve. And this is, like I said, it's an evolutionary and social psychology model. And you see this in business, and people in business where they are in their careers. So, the first group of people really are the people who have no particular desire to change. They're going to retire, usually within 3 to 5 years. And so their desire to adapt is not great. They're not really motivated to change. They're quite happy with the status quo, and they really enjoy their traditions and the way that they've learned to work and how they make a living. The second group are the people who aren't really ready to retire, may not retire for 10 years, but they're very interested in protecting their practice traditions. They're interested in protecting the way that they get referrals, how they do referrals, how they make a living. They see a certain need to change, to protect what they have, but they're really not looking, to continue practice, for beyond 5 to 10 years. And usually in the 5 to 10 year range. The third level, these are people on a curve to create a practice for the future, and they want to practice for 10 to 30 years. Or they're just very interested in change, or they embrace change, or they're not interested in what they're doing, or they think there's a better way to do things. These people are, what you would call people who are early or mid-career. Now, in the beginning, at the status quo, when there's no apparent need for change, nobody's really talking about change or what needs to change, because they're just going about doing everything the way they want to, and they're perfectly fine. But if changes are on the horizon and adaptation is necessary, people can begin to discuss change, and there's probably no significant problems or tension when people initially start to discuss this, unless there are people in denial, and their denial is so great that even the mention of change or there being problems on the horizon cause them to dig their feet into the sand. So things go along fairly well, at least in the early stages of discussion. But then something happens when people actually start to take steps, and they actually have to move towards change. Questions start to surface, all kinds of challenges surface, as people realize that things aren't going to be the way they were. They're going to have to think about, how is this going to affect me? How is it going to affect my circumstances, the way I practice, my bottom line? Will this help me? Will this not help me? Will I lose something? This is where anxiety starts to surface, and tension starts to develop between those who want to protect what they have and those who want to change and adapt for the future. The folks down here who are really have no desire to change and are going to retire in a few years, they don't particularly care, because they're going to be retired and no longer practicing at a point where the rest of us actually have to be on this curve of adaptation. It takes time to adapt. Out here into the future, full adaptation is necessary. And where are we going to be? Are we actually going to adapt? So, what happens with all this tension and anxiety can be this, that the anxiety increases and change reverses direction, particularly for people who want to protect their practice traditions. And it really is a result of either the confusion or the lack of understanding or the sheer number of questions that are asked, the complexities of moving forward. People start to get stubborn and they dig their heels in. And what can happen as a result of that is this, that the people who are really wanting to create a practice for the future, or simply want to change the way they practice because they're tired of the way they do things and the inefficiencies of it, or they simply just want to be able to make a good living, they get dragged down by the tension, anxiety that's generated from the people who are focused exclusively on protecting their practice traditions. But that doesn't have to be the case, okay? So if you believe in theories of adaptation, okay, if you believe in the evolutionary and social psychology models of adaptation, you have to wonder what might happen next. And how are we going to manifest this? And I think seeing this is really important. Maybe it's going to be this. Maybe it's going to be where the people who want to protect their practice traditions are going to embrace change and support and go hand in hand with the people who want to create a practice for the future and for future generations. So maybe it's this, or maybe it's this. I don't know which it's going to be, okay? But we're facing some pretty important questions right now about what are we going to do and who is this for. I, for one, am hoping this is what's going to happen. But unless people make a really conscious effort to deal with their anxiety, their stress, and to develop positive collaborations that are based on trust, mutual support, and organization, then this is the likely result. So I want to go over this one more time. Employers and the state are already following the lead of Medicare and Medicaid by asking for and even buying quality care. That's the future. Secondly, quality care is defined as reasonable access and positive patient experiences. It's about improving community health and managing or at least containing costs. And those of us, those mental health professionals who can generate meaningful use data for mental health and medical collaborations that they need to create, will have a voice, the ability to provide services, and they will have a valuable role in healthcare. There you have it. That's my opinion. I hope this helps.